Hello everyone, welcome to CAPSA. Today we will learn about biguanides or pharmacology of biguanides. So today's topic is pharmacology of biguanides. Okay. So what are biguanides? Actually, biguanides are a family of anti-diabetic drugs. So these are anti-diabetic drugs. According to recent studies, it has proven that it has also some anti-cancer properties. Also has some anti-cancer properties. Okay. Now, where it is obtained from? It is actually obtained from a herb named Galega officinalis. Galega officinalis. These Galega officinalis is also known as French lilac, and the flower and seed parts of this herb contains a chemical constituent named galegin, which is a derivative of guanidine. And this chemical constituent has the blood glucose lowering property. Okay. Now from these chemical constituent, later varieties kind of biguanides are synthesized like metformin, fenformin, buformin, etc. Okay. Now, why they are named as biguanides? Because two guanidine molecule bound with a common nitrogen atom. Okay. Now, how they act? So, how they act? Or the mechanism of action based on the prototypic drug metformin. Okay. They actually inhibits the hepatic gluconeogenesis process and oppose the action of glucagon. So what they do? They inhibits the hepatic gluconeogenesis process and oppose the action of glucagon. Now, how they oppose the action of glucagon? How? So, they actually inhibits the mitochondrial complex 1, that is a respiratory complex, and results in a defective cyclic AMP mediated protein kinase A signaling pathway in response to glucagon. So, what they do? They inhibits the mitochondrial complex 1. As a result, defective cyclic AMP mediated protein kinase A signaling pathway in response to glucagon. Okay. Now, in recent studies, it has seen that biguanides, the prototypic drug metformin, has also a modulated cell-specific anti-inflammatory properties through the AMP activated protein kinase independent pathway or dependent pathway. So, in recent studies, it has shown that it has also a modulated cell-specific anti-inflammatory properties. And these properties mediated through AMP mediate activated protein kinase A signaling pathway that can be independent or it can be dependent. Okay. Now we will look the pharmacokinetic properties of this drug. Now the pharmacokinetic properties. So first one is metformin. Okay. Metformin is given through oral route, IV route and IP route. And it does not bind to plasma protein. It shows a rapid volume of distribution throughout the body. Does not metabolize. If it does not metabolize, obviously it will excreted unchanged by the kidney. So eliminated by the kidney. Now the next drug is fenformin. Fenformin is given through oral, IV and also IP. And it is more lipophilic. Then metformin. Not significantly bound to plasma protein. Okay. Metabolism occur in the liver. Metabolized in liver through the hydroxylation process. And produces hydroxylate metabolite. Okay. And eliminated via urine. Now the next drug is buformin. Okay. So the next drug is third drug, buformin. Buformin is given through oral route and IV route, and it is more lipophilic like fenformin. So obviously shows the higher risk of lactic acidosis. It is not metabolized in the liver. So if it not metabolized in the liver, obviously excreted unchanged through the urine. And it is studied that only 10% bound to plasma protein. Okay. Now what are the adverse effects? Next one is adverse effect. Adverse effect of biguanides are very much important for your exams, okay, or any kind of competitive exams. First one is lactic acidosis, which is very important. Second one is gastrointestinal distress. It includes cramps, increased flatulence, etc. Okay. Now the third one is vitamin B12 deficiency for longer period of time. If we use this drug for longer period of time. Some patients suffer from hemolytic anemia. The fifth one is anorexia. And the sixth one is when the patient continuously taking this kind of drug, they may feel metallic taste. And those patients who are using this kind of drug over than 10 years or more than 10 years, they suffer from nephropathy, retinopathy, etc. Okay. Now, what are the contraindications? Or in which kind of patients we does not use this kind of medication. Okay. So what are the contraindications? First one is it is contraindicated for the patient with impaired renal function. And the patient with impaired hepatic function. Patient suffering from congestive heart failure. And the patient suffering from acute or chronic metabolic acidosis. Okay, and last one is in pregnancy. Because due to more lipophilic nature, it can cross the blood placenta barrier. Okay. Now, what are the clinical use? So, the last one is the clinical use. They are used in the treatment of type 2 diabetes mellitus and also for the treatment of PCOS or polycystic ovarian syndrome, and in the treatment of obesity. So that is the end of the lecture. If you like my video, please do like, comment and subscribe and share to Grow CAPSA for your best support. Thank you for your attention.